We're seeing the realization that you can design things for health without even necessarily telling people. My name is Alina Baciu, and I'm a Senior Program Officer for the Institute of Medicine. The IOM is the health arm of the National Academy of Sciences, and the IOM has been in existence since 1970. The work of the Institute of Medicine is important for architects to know about because the IOM is a major influence on policy in this country, especially health-related policy. And we have increasingly been looking at the wide range of interactions between health and the social determinants of health, such as education and income, and the built environment and the natural environment. And we are seeing, both at the local level, increasing collaboration among different sectors of government, the public and private sector, and different disciplines. And we are also seeing at the national level a National Prevention Council that has brought together the different departments of the federal government to come and talk about health and what they are doing in each of those. I would say that most Americans tend to look at health as something that is produced in the doctor's office in those 2 or 3 hours that most of us spend getting our blood pressure checked and our blood tested and so on. But the fact that we are becoming aware of through a range of research is that health is something that is shaped in communities, shaped by our transportation systems, by the buildings and the neighborhoods and the parks and the grocery stores. I think that there's a need for recognition, both in public health and in the design community, that if you want to achieve change, it can't really happen, creative, brilliant individual by creative, brilliant individual at a time. It has to happen at a larger scale, and the way to do that is to begin to advocate for policies that are based on evidence and for policies that are based on best practices and that will improve people's health in a really fundamental way. We're seeing the realization that you can design things for health without even necessarily telling people. We're doing this because it's going to be good for your health. Because what is good for community in creating and strengthening the social bonds is also good for health, is also good for getting people physically active, which is good for health. It's good for economic development, which means more jobs, more money in people's pockets, which is also good for health. So all of those things are really connected. And so I think a lot of the work that the IOM is doing really has to do with connecting the dots and with really lifting up the evidence base on best practices, on how you do that connecting of the dots.